And good evening, and thanks for joining us here on this Friday. I'm Mark Mullins. First at 6 tonight, many hospitals in our area already feeling the strain from an increase in COVID patients are now preparing for another surge. Those who may have been infected over Thanksgiving could start showing symptoms any day now. WRTV's Megan Sanctorum is working for you to find out what hospital administrators are doing to prepare, and shares the story of a local family who almost lost a loved one to COVID.
It was just so many unknowns, and it was really, really scary.
More than 100 days on a ventilator and months of recovery. Stephanie Singh's father-in-law is a COVID-19 survivor, but the weeks leading up to his release in September were long.
There's so many ups and downs, so he would make progress and then take a couple steps back. And again, we were told that he would die and that he wouldn't make it, and that is so scary.
Her family is not alone. Healthcare leaders in our area say they're feeling the pinch as COVID hospitalizations increase.
Frequently have, way more patients holding in the emergency department, waiting for a bed than normal. Many of the hospitals around town, including ours, have been had to be placed on diversion for emergency services off and on over the last couple weeks.
The vice president of medical affairs at Franciscan Health says the worst could be yet to come.
Probably still a little early from when we would expect to see the additive effect of Thanksgiving on top of what we're already experiencing.
The chief of medicine at Eskenazi Health saying the same thing.
We are anticipating more patients coming in post-Thanksgiving. That can be anywhere from 7 up to 2 weeks after the holiday before we would expect to see that. We've been preparing for weeks with flexing beds to make them more ICU capable. We are making sure we have staff on hand and ready.
Doing everything they can, hoping those who do come in recover like Singh.
The week of Thanksgiving, he got in the driver's seat and he drove us home. 3 months ago, he was not breathing on his own. 2 months ago, he was not walking on his own, and now he's behind a driver's seat, and that was just so amazing.
But she knows not everyone is as lucky.
Try to do everything you can to keep your family, your loved ones, and yourself safe, because you don't want to be in the situation we were in. There's a lot of guilt when you may have been the reason one of your family members got COVID, and not father-in-law for 5 months. Being told he was going to die was really, really scary. Just don't be that family,
Working for you, Megan Sanctorum, WRTV.